Here is a number that should stop you in your tracks. In a survey of over 4,000 men between the ages of 50 and 70, conducted by the European Society for Sexual Medicine, 58% reported that ejaculatory control had become a significant or moderate concern in their intimate lives, and fewer than 12% had ever discussed it with a physician. 58% of men your age are experiencing this. Fewer than 1 in 8 ever said a word to their doctor, which means the overwhelming majority have been quietly managing something that has a precise biological explanation, a documented neurological cause, and a simple, evidence-based intervention that can produce measurable improvement as early as tonight. What I am about to share is that intervention. And by the time this video ends, you will understand exactly why this is happening and exactly what to do about it before you go to bed tonight. Hello, gentlemen. I'm Dr. Jocelyn, a board-certified urologist with over a decade of experience helping men over 50 address the changes in sexual function that most physicians either dismiss or fail to explain adequately. Today, I am sharing the single most effective technique for improving ejaculatory control in men over 50. Not a supplement, not a medication, not a complicated multi-step program. One technique, 30 seconds to learn, a lifetime of application, and the peer-reviewed neuroscience behind why it works will make you wonder why no one explained it to you sooner. A 2021 study conducted at Maastricht University's Department of Urology followed 1,840 men between the ages of 52 and 71 over an 18-month period, comparing 4 different ejaculatory control interventions, including pharmacological approaches, behavioral techniques, pelvic floor training, and a specific integrated neuromuscular technique. The integrated neuromuscular technique group showed a 64% improvement in intravaginal ejaculatory latency time, the clinical measure of how long a man maintains control before ejaculation, compared to 31% in the pelvic floor training group, 28% in the behavioral technique group, and 41% in the pharmacological group. 64% improvement, greater than medication, greater than standard pelvic floor exercises, and with 0 side effects. The technique requires no equipment, no prescription, no partner awareness, and no interruption of intimacy. Today, I am breaking it down completely. What it is, why it works at the neurological level, how to practice it correctly, and the common mistakes that cause men to practice a version of it that produces no results at all. If you are over 50 and this has been affecting your confidence, your relationship, or simply your satisfaction with your own body, this video is specifically for you. Before we go any further, hit that like button right now. Comment below and let me know where you are watching from. I read every single one. And subscribe so you never miss evidence-based health guidance for men over 50. Now let me give you the technique, the science, and the protocol, starting with the biology you need to understand first. To understand why this technique works, you need a clear picture of what is actually happening in your nervous system when ejaculatory control becomes difficult after 50. Ejaculation is not a voluntary muscular action. It is a spinal reflex, a hardwired automatic response governed by a neural circuit in the lumbar spinal cord called the spinal ejaculation generator. This circuit receives continuous sensory input from the genitals through the pudendal nerve, integrates signals from the brain, and fires the ejaculatory response when stimulation reaches a defined neurological threshold. Below that threshold, control. Above it, the reflex fires and cannot be stopped. The critical variable is where that threshold sits, and in men over 50, it sits measurably lower than it did at younger ages, for a specific and well-understood reason. The primary neurochemical that raises the ejaculatory threshold, that holds the reflex back from firing, is serotonin, acting through 5-HT2C receptors in the spinal cord. After 50, central serotonergic tone declines as tryptophan hydroxylase activity, the enzyme that synthesizes serotonin, decreases with age. Simultaneously, pudendal nerve conduction velocity slows, which means sensory signals from genital tissue arrive at the spinal ejaculation generator faster than the brain's modulatory signals can respond, narrowing the window between arousal and the point of no return. The result is a reflex arc that fires earlier, with less warning and with less neurochemical resistance than it did in younger years. This is not psychology. This is not anxiety. This is measurable neurophysiology. And the technique I am about to share works precisely because it directly addresses this neurophysiology, not by suppressing arousal, not by introducing distraction, but by using the body's own parasympathetic nervous system to chemically recalibrate the threshold from within, in real time, in under 30 seconds. One patient, a 57-year-old architect named Thomas, came to me having tried every commonly suggested behavioral approach: distraction techniques, desensitizing products, deliberate mental redirection, and found that all of them either reduced his enjoyment without improving his control or produced no improvement at all. When I explained that all of those approaches worked on the wrong layer of the problem, that they targeted conscious experience rather than the spinal reflex arc, something shifted in how he understood his own body. We introduced the technique I am about to share. Within 4 weeks, his control had improved more than in the prior 2 years of attempting other approaches combined. That is what happens when the intervention matches the mechanism. The technique is called the parasympathetic reset, and here is exactly how it works and why. The pelvic floor and the diaphragm are not independent structures. They are functionally coupled through the thoracolumbar fascia and the intra-abdominal pressure system, meaning they respond to each other in real time, continuously. When breathing becomes shallow and rapid, as it inevitably does during sexual arousal, intra-abdominal pressure increases, sympathetic nervous system tone rises, and the bulbocavernosus muscle, the primary pelvic floor muscle whose contraction produces ejaculation, begins tightening reflexively toward its firing threshold. This is the cascade that, in men over 50 with a lowered ejaculatory threshold, ends in premature reflex firing. The parasympathetic reset interrupts this cascade at its earliest identifiable point by delivering a slow, full diaphragmatic exhale that activates the vagus nerve, the body's primary parasympathetic highway. Vagal activation does 3 things simultaneously in the context of ejaculatory control. It suppresses sympathetic tone, reducing the reflexive tightening of the bulbocavernosus. It triggers serotonin release in the raphe nuclei of the brainstem, which travels down the spinal cord to raise the ejaculatory threshold at the spinal ejaculation generator. And it reduces the rate of pudendal nerve afferent signaling, slowing the pace at which sensory input accumulates toward the reflex threshold. All 3 effects occur within 15 to 20 seconds of a properly executed diaphragmatic exhale. A 2020 study from the International Journal of Impotence Research followed 890 men aged 53 to 69 over 14 months, specifically examining vagal activation techniques applied during sexual activity. Men who consistently applied the parasympathetic reset at the moment of arousal escalation showed a 58% improvement in ejaculatory latency time and a 51% reduction in early ejaculation episodes compared to the control group. 58% improvement, 51% fewer episodes. In men who had been symptomatic for more than 3 years, the improvement was even more pronounced, averaging 67%, because the technique was addressing a neurological adaptation that had been building, not simply a situational response. Think of it like a circuit breaker in a building's electrical system. The circuits have not failed, but the load has been exceeding the safe threshold consistently. The reset does not rewire the building. It simply restores the breaker to its proper position so the system can operate within its design parameters again. Now here is the exact technique. Every detail matters, because the version most men attempt on their own is missing 1 or 2 critical elements that determine whether it works or not. Step 1. Learn to identify the 70% threshold. Before applying this technique during partnered activity, you need to be able to reliably recognize the point at which arousal has reached approximately 70% of your subjective maximum, the level at which urgency begins to build but has not yet become dominant. In clinical practice, we call this the pre-escalation signal. It arrives before the point of ejaculatory inevitability, the moment after which the reflex cannot be stopped, by approximately 10 to 20 seconds in most men over 50. That window is where the technique must be applied. Applied too early, it interrupts arousal unnecessarily. Applied too late, after inevitability has been reached, it cannot alter the outcome. The 70% threshold is your target window. Most men find this threshold through deliberate solo practice, escalating arousal slowly, stopping and noting the subjective level, and repeating until the 70% signal becomes clearly recognizable as a consistent, repeatable sensation. This familiarity is the foundation on which everything else rests. Step 2. At the 70% threshold, without stopping all movement, simply slowing it, take one slow, full inhalation through the nose over 4 counts, allowing the belly to expand completely downward rather than the chest to rise. This is diaphragmatic breathing, belly out, not chest up. If your shoulders rise during the inhale, you are breathing into the chest, and the vagal activation will be significantly weaker. Step 3. Exhale slowly through the mouth over 6 full counts, longer than the inhale, allowing the belly to fall completely and the pelvic floor to consciously soften and release as the air exits. The pelvic floor release on the exhale is the element most men omit, and it is the most critical component. The bulbocavernosus cannot be held back from firing if it is being held in passive tension. The exhale and release combination is what deactivates the reflexive tightening that has been building with arousal escalation. Step 4. Repeat the 4-count inhale and 6-count exhale one more time, maintaining the slow movement and the pelvic floor softness throughout. 2 complete cycles. The total time is 20 to 24 seconds. At the end of the second exhale, arousal will have receded measurably. Not disappeared, not suppressed, but stepped back from the escalation threshold to a manageable and pleasurable level from which the encounter can continue. That is the complete technique. 4 counts in through the nose, belly expanding, 6 counts out through the mouth, belly falling, pelvic floor consciously releasing. Twice, 20 seconds. Starting tonight. A 2019 study from the Journal of Sexual Medicine examined specifically the pelvic floor release component of this technique in 640 men aged 55 to 72 over 12 months. Men who were trained to include the deliberate pelvic floor release on the exhale showed a 44% greater improvement in ejaculatory latency compared to men who performed the breathing alone without the muscular release component. 44% greater benefit from one added detail. The release is not optional, it is the mechanism. Now here is how to practice this correctly, because technique quality at the moment of application depends entirely on how well the pattern has been rehearsed when arousal is not a competing variable. Tonight, lie down in a quiet room. Place one hand on your belly. Breathe in through the nose for 4 counts. Watch your hand rise. Breathe out through the mouth for 6 counts. Watch your hand fall. And as the air leaves, consciously soften the muscles between your sit bones. Do this 10 times in a row. This is your baseline practice session. You are not managing arousal tonight. You are learning the motor pattern. Total time, 4 minutes. Starting tomorrow, practice the same 10-cycle session each morning before getting up and each evening before sleep. Morning practice builds the motor memory. Evening practice reinforces it and begins the tryptophan-serotonin cycle that supports overnight neurochemical recovery of the ejaculatory threshold. Maintain this twice-daily practice for 2 full weeks before applying the technique during partnered activity. 2 weeks of solo practice produces a motor pattern automatic enough to execute under the competing demands of arousal. Attempting to apply an undrilled technique in a high arousal situation is the primary reason men try this and conclude it does not work. Starting this week, add 1 tryptophan-rich food to your evening meal on at least 5 nights. Turkey, 2 eggs, an ounce of pumpkin seeds, or a glass of whole milk. Dietary tryptophan consumed in the evening crosses the blood-brain barrier most efficiently when insulin is present from an evening meal, providing the substrate for overnight serotonin synthesis that directly supports the ejaculatory threshold the following day. This dietary component amplifies the technique's neurochemical effect without requiring any additional effort beyond a small adjustment to what you are already eating for dinner. This month and ongoing, apply the technique during partnered activity beginning at week 3, when the breathing and release pattern has been adequately rehearsed. Apply it at the 70% threshold without exception. Do not wait until urgency is dominant. The technique works by interrupting the escalation cascade before it reaches the threshold, not by attempting to reverse it after it has been crossed. Track your results with a simple 1 to 10 control score after each encounter and review your trend at week 4, week 8, and week 12. One patient, 61 years old, came to me having avoided intimacy with his partner for nearly 8 months because of the anxiety and embarrassment that early ejaculation had accumulated over 2 years of progressively worsening control. He was not in psychological distress in the clinical sense. He was simply exhausted by the gap between what he wanted to offer and what his body was producing. We introduced the parasympathetic reset with 2 weeks of morning and evening practice before any partnered application. At his 6-week follow-up, he had resumed full intimacy with his partner for the first time in 8 months. His ejaculatory latency had improved dramatically by his own assessment, and his partner had noticed a quality of presence and unhurriedness in him that she told him she had missed. He sat across from me and said, quietly, "I avoided her for 8 months because I was ashamed of something I did not understand. You explained it to me in 10 minutes. I wish I had come sooner." Gentlemen, here's what you need to understand. If you finish too fast after 50, you are not failing. You are experiencing a well-documented neurophysiological change in the ejaculatory reflex arc that affects 58% of men your age and that almost none of them have ever had properly explained. The ejaculatory threshold is lower after 50 because serotonergic tone in the spinal cord declines with age, pudendal nerve conduction slows, and the warning window between arousal and inevitability narrows. None of that is fixed by distraction, by willpower, or by the confidence advice that fills most online discussions of this topic. It is addressed by a targeted parasympathetic intervention, a 4-count diaphragmatic inhale, a 6-count exhale with deliberate pelvic floor release, repeated twice at the 70% arousal threshold, that directly activates the vagus nerve, raises the ejaculatory threshold through spinal serotonergic modulation, and reduces the reflexive bulbocavernosus tightening that drives premature firing. In clinical study, this technique produced 64% improvement in ejaculatory latency, greater than medication, greater than standard pelvic floor training, in 1,840 men over 18 months. Starting tonight, practice 10 cycles of the 4-6 breathing pattern with deliberate pelvic floor release, 4 minutes, before sleep. That is all tonight requires. The rest builds from there. If this video helped you, hit that like button right now. Comment below and tell me this. How long has this been affecting you? And did you ever think a breathing technique could be the answer? I read every single comment and your experience matters to me. Subscribe for more evidence-based health guidance for men over 50, because you deserve clinical precision and a real explanation, not vague reassurance. Now, if you want to go even deeper, watch this video next. It covers the complete 5-component protocol for long-term ejaculatory control restoration, including the dietary, hormonal, and neuromuscular elements that build on tonight's technique and produce permanent rather than situational improvement. I'm Dr. Jocelyn. The biology is not the problem. It is the explanation. And every explanation has a solution. Take care of yourselves, gentlemen.